The COVID-19 crisis has certainly magnified racial and economic disparities in our community and all across the country. Austin City Council member Nathasha Harper-Madison represents the eastern section of our city, and this is a part of town that has really felt the impact of this pandemic in some profound ways. Thank you so much for being with us.
Thank you for having me. It's my pleasure.
As we know, Black and Latinx Austinites are more likely to live in poverty, more likely to suffer from some chronic health conditions that make them more susceptible to the coronavirus. What are your concerns right now, and what are you hearing from your constituents?
Yeah, the concerns and the needs they vary and there are many. In the short term, access, all things access to testing, access to healthcare, access to data, access to community outreach. And along those lines, my office and eventually we'll be partnering as this pilot evolves. My office will be partnering with various community organizations, faith-based institutions, and the City of Austin's communications folks to really put together a very robust, comprehensive outreach platform. We really need to specifically be speaking to people in African American and Latinx communities.
What are you hearing on the ground? What are some of your constituents reaching out and telling you and saying, hey, we need X, Y, and Z?
I think it's pretty obvious, to some degree that the people that have been deemed our essential workers are generally speaking people that live in districts 1 through 4. And so the folks that have to keep going to work and recognize the risk that they're taking, they have concerns about themselves and their families. There's concerns about all of the disparities and shortages. There's food and healthcare and transit and transportation, basic hygiene items, diapers and wipes and feminine hygiene products. You name it, the things that people need on a daily basis to survive. There were people in our community who were already struggling to provide those needs for themselves and their families. And this, crisis has certainly exacerbated those issues and is really shining a bright light on inequities in the city of Austin.
As you mentioned, the risks and sacrifices during this pandemic seem to be weighing heavily on working class, lower income families. Tell me what the city is doing to help these folks. I've heard about this $15 million emergency reserve money. Where is that money going? What are some ways the city is helping people struggling right now?
So that RISE funding will definitely be helpful. The way that it's laid out is half of that will go to organizations that the city has relationships with, social services organizations, and the other half will come in the form of immediate cash assistance, which are both important. But beyond that, we've already made the effort to stay evictions. We've already made the effort, and we're able to accomplish in our last council meeting $46 million that went to Austin Energy to help subsidize, electricity for folks. It's going to be hot. It was already 90 degrees last week. It's going to be a hot summer. And with us doing what we have to do and staying safe and working from home, folks are going to need to make certain that they have access to their utilities. The community care clinics are reopening on the east side, and they're rolling out 4 testing sites, which is hugely important.
Natasha, if people are in need of some of these services you were talking about and want to get information, what is the best place for them to do that?
My office and all the other council offices are all putting together a list of resources that are available. Some of them more comprehensive than others, but the truth of the matter is if you want one singular source where all the information lives in the same place, the City of Austin's COVID-19 page is your best bet.
Are you hopeful these systemic inequities that have been very glaring right now will be addressed in new and different ways?
I do have that hope. And I think in a time like this, where everything's so uncertain, the one thing we can all cling to unilaterally is hope. So I do have it. I do recognize that, some of the inequities that there are folks who didn't recognize what the problem was because it doesn't directly affect them. There's a bright shining light that's getting glared on inequities that are historic and really rooted in structural racism. If we were able to very quickly repair those systems, if we were very quickly able to get more people, focus on the digital inclusion component, deploy broadband for everybody and devices in the hands of every scholar in the city. If we could do that now, we could do that anytime. If we can open more clinics and testing sites and be more creative with how we deliver healthcare, we could do that anytime. If we can stay some of these oppressive systems that really make it so that people are always trapped in this cycle of poverty, we could do that anytime. So recognizing that, I think is definitely gonna, folks keep saying that, what do they say? I can't wait for it to get back to normal. There will be no normal anymore, and recognizing that. And what we come back to on the other side of this, it'll be a whole new world. And, with emerging technologies and innovation. And, there is definitely some hope on my part.
I think we'll make it through all together. Thank you so
I
much,
believe you.
Councilmember
Thank you.
Nathasha Harper-Madison, who represents District 1 in Austin on the east side. Take care.
You too. Thank you.